My name is Tiffany Berg. I'm a clinical hospice chaplain. I have been a chaplain for 16 years. Hospice is very dear to my heart. Having had loved ones go through the hospice experience and knowing how a team can support the patient and loved one, it's been so valuable, even priceless, to know what hospice is and when to bring hospice into my loved one's life. As a clinical hospice chaplain, I learned firsthand about chaplaincy 16 years ago with the passing of my late husband. I, at that time, did not know what hospice was. And when the hospice chaplain and nurse and social worker and aides came in to support our family, we understood very quickly that this team was specialized and they could help us in ways that we didn't initially understand. Watching that hospice team care for my late husband gave me so much peace and security, peace of mind, knowing that we had had the discussions that were essential and that he was comfortable at the end of his life. Clinical chaplaincy is a discipline that supports the family and the caregivers through end of life. Chaplains aren't a religion, but it's really a discipline of questions, knowing what questions to ask at the end of life so that a patient and the family can come to peace and closure at the end of life. What's the difference between curative care and comfort care? Curative care has a goal at the end that the patient will get well. They will be restored to how they were prior to a disease or an injury. Curative care means that there are steps that can be taken to heal the patient. In comfort care, those curative measures have been exhausted. In comfort care, the goal is to keep the patient comfortable, free from distress or agitation, free from pain. So the goal of curative care is to cure the patient. The goal of comfort care is to give them the greatest measure of comfort they can have until the end of their lives. What are the signs that it's time for hospice care? One of the greatest signs is going to the emergency room often. When there are frequent visits to the ER, that indicates there is a level of distress, physically, emotionally, where the body is shutting down and having a harder time. So hospitalizations, frequent hospitalizations is a sign, as well as falls. If there are falls that are frequent, that can reflect either cognitive decline or physical weakness. Another indication that it's time for hospice care is the quality of life. What is the quality of life for your loved one? When you look at all of those things, it may be an indication that it's time for a hospice team to come and do an evaluation and to bring the patient onto hospice care. Often in families, there are disagreements about levels of care or steps to be taken when it comes to curative care, palliative care, comfort care. We as a team want to educate families so that they can come together and make the best decision on behalf of their loved one. There are a lot of big emotions at the end of life, and our team is skilled and trained and educated on how to listen to those big emotions and give the greatest resources where there's the greatest need.